In today's video, I wanted to talk about my fifth pearl for health and fitness. Let's get into it. There are said to be many potential health benefits of inversion therapy for your respiratory system, circulatory system, digestive system, and immune system, not to mention anti-aging benefits and mental health benefits, similar to those of yoga. So the goal of inversion therapy is to reverse the compression of gravity on the spine. It's usually done on an inversion table. These tables have ankle holders that can be adjusted to different positions, tilting you backwards, including one where you're completely upside down. Inversion tables and other types of inversion therapy using chairs, boots, and other devices that enable you to hang upside down have been around for a long time. The idea is that by letting gravity exert its effects on your spine, you can get rid of back pain, neck problems, or any number of complaints. So there's been a lot of ads on the internet touting inversion therapy for improving lymph flow in order to boost the effectiveness of the immune system, for correcting skeletal misalignments, improving balance and circulation, and for reducing stress on the joints, ligaments, and muscles. Right now, there's no hard empirical data that says it does any of these, top doctors say. So more studies need to be conducted. There's been some studies. In a 1985 study, U.S. Army researchers using x-rays of the spine of 15 volunteers showed that the distance between the vertebrae and the lower back increased significantly during a 10-minute inversion session. In a 2012 study of 22 patients getting physical therapy while awaiting surgery for a slipped disc, British researchers found 77% of the patients who did inversion on a teeter table ended up not having surgery, compared with 22% of the patients who just received physical therapy alone, which was very surprising to the doctors to see how effective it was. David Mandello, professor of neurosurgery at Newcastle University in Newcastle, the study received no company funding, but Teeter, which sells teeter tables in the UK, is funding follow-up research. Bottom line, this may stretch out the spine and decrease pressure on the disc and nerve roots. It may also increase the space between the vertebrae. So when we look at the big picture, when you hang upside down, oxygen-rich blood flows to your brain. Since your brain is the largest consumer of oxygen in your body, more blood means more oxygen, which means better brain function. This may stretch out the spine, decrease pressure on the disc and nerve roots. It may also increase the space between the vertebrae. So potential benefits of hanging upside down during an inversion therapy session include short-term relief from back pain and scoliosis, improved spinal health, increased flexibility, reduced need for back surgery. Now, there's little proof at this point to back up the efficacy of these benefits. Studies haven't confirmed the benefits of hanging upside down yet. We just need more studies from trusted sources. But the preliminary results are very interesting. It's only been done on a small scale. As with other alternative therapies, when you talk about acupuncture or cupping, the results of inversion therapy are different for everyone. I can speak to acupuncture and cupping, and I do both once a month, and I think they're phenomenal. So more research is needed overall. Some of the risk, inversion therapy is not safe for everyone. While you're hanging upside down for more than a few minutes, your blood pressure can increase, your heartbeat also slows down. There's also increased pressure on your eyes, so avoid inversion therapy if you have high blood pressure, heart condition, glaucoma, back or a leg fracture, osteoporosis, or a hernia. So hanging upside down also isn't safe if you're obese, overweight, or pregnant. Always check with a doctor before trying inversion therapy. So there's some very popular reasons, digging in a little deeper, that people practice inversion therapy today. So when we talk about relieving back pain, our body is affected by the downward pull of gravity through everyday things like walking and moving. These may contribute to spinal compression, pinched nerves, and back pain over time. So hanging upside down may help alleviate back pain associated with compression by temporarily stretching the muscles and ligaments around the spine. Number two, it may help maintain your posture. Job stress and strain, as well as activities like sitting at a desk or performing repetitive tasks, can all have negative effects on your spine. These activities may also lead to misalignment of the hips and contribute to poor posture. Inversion therapy gives your spine the opportunity to stretch, realign, and improve your posture. Number three, relaxing muscles. Inversion therapy is an effective way of relaxing and stretching out your muscles. Hanging upside down allows gravity to relieve pressure on the lower part of your body. This exercise may also trigger a series of cracking sounds across your body, which also alleviate build-up pressure. Number three, clearing the lymphatic system. Because the lymphatic system only flows in one direction, waste may begin to collect and build up over time. Spending a few minutes upside down could help your body to adjust lymphatic flow and remove the waste naturally. So another benefit possibly is improving blood circulation. You can give your heart a helping hand while you're hanging upside down. Being inverted helps move your blood to the upper part of your body more easily. So another study, if we dig a little deeper, a study done on people with chronic lower back pain showed that practicing inversion therapy at 60 degrees angle curtailed back pain after 8 weeks. Optimizing spinal health, by creating more space between the spinal disc and vertebrae. Inverted traction kind of facilitates the delivery of protective fluid around spinal discs that rehydrates them. These discs act as shock absorbers, protecting your spine from any unanticipated damage. Another study revealed how inversion could cause spinal pressure to fall to zero and potentially prevent disability from back problems. The authors also concluded that regular use of an inversion table may largely curtail the need for back surgery. Better flexibility, another benefit that supporters of inversion therapy claim is improved core strength and flexibility after hanging in this position. According to them, this posture is supposed to speed up the circulation throughout your muscles and joints, making them more strong. So realigning your spine, several everyday factors such as sitting, like we talked about, carrying heavy bags on your shoulder, lifting heavy weights, tend to put a lot of pressure on the spine. Inverting at 60 degrees causes pressure of the spine to drop to zero and help promote spine alignment, as shown in a number of studies. So it does make sense. When you invert your body, you take the pressure off your back. Your spine gets ample space to stretch and move back into alignment. Improving focus and brain function. Your brain, large amounts of oxygen and energy in your body to function. Your brain is very important. So when you invert upside down, oxygen-rich blood rushes to your head. More oxygen means more better brain performance and improved focus. So keep in mind, the evidence supporting these benefits is not sufficient. More research is needed to back up the efficacy of these benefits. Moreover, inversion therapy may not be safe for everyone, especially if you have high blood pressure, glaucoma, heart disease, or osteoporosis. Hence, caution needs to be practiced before trying out this technique. I'm a big proponent of inversion therapy. I've been doing inversion therapy for over 9 years, and I do it at least every other day at 2 minutes when I get up in the morning, and 2 to 3 minutes, and then 5 minutes when I go to sleep. I was doing it every day for a while. I had some back pain going on. Long story short, it was mainly due to some just ligaments and poor stretching techniques that I used to use in the old days. When I stepped up my stretching, I got orthotics in my shoes. I had some, flat feet and some foot problems there. And I had some ligament problems in my glutes and my hamstrings. And when I got that dialed in and stretched out, a lot of the pain curtailed. But I noticed the difference, especially in the beginning of inversion therapy, the cracking and the alignment after 2 weeks, I just felt like I had more energy. I felt just so much better in my back and my alignment, my posture. And so I went through a number of tables, and then I stepped it up and got the teeter table, and I've had that for years. It's just a phenomenal product. That's the one I recommend, is the teeter table. I'll leave it in the description. But I just think this is one of my pearls, my 44 pearls. It's in my top 5. And doing this a couple times a day, 3 times a week, I think, start slow with it. And I hang, horizontally, and then I slowly invert the table. And then I go almost full blast. But all you need is 60 degrees to get that compression release. And, with inversion, I do cupping once every couple months. I do acupuncture once every couple months. But I think inversion table is a small investment you can make, because so much pressure is put on your spine. The evidence is there of just walking, sitting, running when you're in the gym, if you're lifting weights and putting pressure on your back. It's such a delicate area, and there's just so much space there for those discs. And when you relieve the vertebrae, you allow fluids to get in there and I think heal those discs. And, I know other people that have sworn by the inversion table, and they had serious back problems and pain, and it really helped reduce the pain or eliminate it. So I think for a preventative measure, if you're doing fine just right now, to incorporate this into your health protocol, it's just a winner. And I think it's helped me to avoid any major injury. And I've always said that I've never had surgery. I've never had joint problems yet. No back, shoulder, knee, no major problems with my disc. I had a very good training partner when I was younger, JT, who taught me how to work out and train and stretch. I didn't always follow the stretching protocol, but I tell you, years later, this guy was spot on. And then I incorporated things that I learned from other training partners and doctors over the years from all my reading and research. But I highly recommend inversion therapy for your health and fitness. I just think even stress reduction, maintaining your back, maintaining your posture, flexibility, I don't think you can go wrong. It's a small investment. Thanks for your time. Be creative.